Good morning, everyone. It gives me immense pleasure to welcome all of you to the opening ceremony of National Nutrition Week NIMHANS 2021. Every year, National Nutrition Week is observed from September 1st to September 7th. The theme for this year is Feeding Smart Right from the Start, which focuses on consuming the right kind of food to keep yourself fit and healthy. The objective of the National Nutrition Week is to enhance the nutritional practice awareness among people of community through training, timely education, seminars, different competitions, and many other campaigns, and to make a healthy nation. It is my pleasure to extend a very warm welcome to the Director of NIMHANS, Dr. Pratima Murthy. She was a professor and head of Department of Psychiatry and took charge as full-term director of Institute on 18 June 2021. She brings about 30 years of extensive experience and exceptional accomplishments in the field of mental health. A well-recognized leader in addiction psychiatry, she has been instrumental in the successful development of the state-of-the-art Center for Addiction Medicine at NIMHANS. I would also like to welcome Dr. B.S. Shankara Narayana Rao, the Registrar of NIMHANS, Dr. K. Muralidharan, Medical Superintendent of NIMHANS, Mrs. Veena Matthew, the Senior Dietitian, and other NIMHANS staffs who have joined the meet. Now I request Dr. K. Muralidharan sir to address the virtual gathering and cast the light of his knowledge upon us.
Thank you so much, Sneha. A very good morning to all our employees and to the dignitaries present here. It is indeed a matter of great pride for me to be able to have a director launch in a big way this National Nutrition Week. I think this is one of the first of its kind that we're doing at NIMHANS. It is important from a hospital perspective to have good inputs regarding nutrition and dietary practices, considering that we are a specialty hospital who deal with a lot of neurological and psychiatric illnesses, which come under the category of non-communicable disorders, where diet plays an important part both in the causation, the etiology of these disorders, as well as in the prognosis of these conditions. So this is a very, very important thing that we need to follow in our hospital especially. And considering the theme for this year's National Nutrition Week, Feeding Smart Right from the Start, again, this is very relevant to our hospital, given that we see patients from the pediatric age group to the geriatric age group. It is important that adequate, proper nutritional advice is given to all categories of patients so that the long-term prognosis can be improved to a great extent by enhancing the nutritional practices. So in that context, as medical superintendent, it gives me great pride to be a part of this initiative and launching this. More importantly, we are doing it as a part of the Amrit Mahotsav of Indian independence and to commemorate a week-long of activity that focuses on nutrition, which affects the majority of our population as well. So with these few words, I'd like to again thank Mrs. Veena Matthew and the team from the dietary section for coming forward with this important initiative, which will orient all our staff and patients towards the importance of nutrition at various stages of life. So these few words, thank you, and all the best for the program.
Thank you, sir, for your precious words. Now I request Mrs. Veena Matthew to address the virtual gathering and express her thoughts on this year's theme, highlight the importance of nutrition right from infancy and childhood, and also emphasize on the events which are being planned to be conducted these 7 days.
Sneha. Respected Director, Registrar, Medical Superintendent, Deputy Medical Superintendent, and I am extremely delighted to take this opportunity to introduce you all this year's National Nutrition Week theme, that is Feeding Smart Right from Start. Before going further, I request Director, Registrar, and Medical Superintendent to grant me the permission to start this event. As you all know, good nutrition is the key to a good mental health and physical health. Adequate nutrition during all the stages is very essential for the proper functioning of the body and also to avoid deficiencies. A healthy diet throughout the life promotes healthy pregnancy outcomes, and you must be knowing that different stages in your life, from pregnancy, from infancy till the old age. So each and every age, it is very important to give importance for the nutrition. So healthy diet throughout the life promotes healthy pregnancy outcome among women and also supports normal growth and development and healthy aging for others. So eating a nutritious diet during pregnancy is linked to good brain development and also for infants and also for the mental health and development for others and healthy aging for others. And eating nutritious diet during pregnancy is linked to good brain development for the infants and healthy birth weight for the infants and also to reduce the risk of birth defects. Adequate nutrition during infancy is essential for lifelong health and well-being, and development of chronic diseases during adulthood can be slowed or prevented if the quality of nutrition intake is good, and a healthy aging for senior citizens. I would like to conclude by saying that upcoming 7 days, our 7 dietitians would be coming up with the 7 different nutrition topics focusing on the nutritional needs required during 7 different stages of life. The first day, nutrition during infancy will be covered by Monisha Suvarna. Second day, nutrition for toddler and preschooler will be covered by Erlin Abby George. And third day, nutrition for school-going children will be covered again by Erlin Abby George. And nutrition for adolescents will be covered by Anjali Naik. Nutrition for adults will be covered by Sneha Susan Matthew. And nutrition for old age will be covered by Jayasree. And nutrition for pregnancy and lactation will be covered by Saujanya Dikshit. I hope this nutrition week turns out to be a grand success in delivering our ideas to you all, and also it will help you and your family to implement that in your life and implement that in your daily lives and bring out a grand difference in your overall health and well-being. Thank you, sir. Thank you, madam.
Thank you, ma'am, for your valuable words. Now I request Dr. Pratima Murthy to inaugurate the event as well as address the virtual gathering and inspire all of us through her motivational words as we begin with the event.
Thank you very much. It's with great pleasure that I inaugurate the National Nutrition Week at NIMHANS. It's really very nice to be here on this occasion. We heard the medical superintendent talk about the importance of feeding smart right from the start, and it's very nice to see that you're starting a program which starts with infancy. Perhaps it has to start antenatally, right up to the elderly, and what the importance of eating right is. And Mrs. Beena also mentioned that it's very important for both mental and physical health. So one of the things that was always stuck in my mind is this phrase, "You are what you eat." So I wondered where this phrase came from. And of course, I just checked it out online, which is the best way to do it nowadays. So the first thing of the time apparently it was used was in 1826. A French lawyer, Antoine Savrin, he was writing about gout. And then he used this phrase, "You are what you eat." Similarly, in another essay on spiritualism and materialism in 1863, there was another German called Ludwig Feuerbach, who also wrote, "Man is what he eats." So, and they didn't realize that their quotations would be taken so literally. And, but they were stating that the food that a person eats has a bearing on one's mind and one's health. So right from there, you see that what you eat has become very important. Of course, in Indian literature, we all know the different kinds of foods, the Vata, Pitta, Kapha producing foods, and what is good, what is, various kinds of aharas that we talked about, the sattvic aharas, the tamasic aharas, and so on. But I think now and more than ever, we are realizing the importance of diet on so many aspects of our well-being, both physical as well as mental. We also know that it's not just diet alone, but nowadays we know that diet, good exercise, avoiding behaviors like smoking and alcohol consumption, reducing stress are all very important in actually maintaining a state of health. And when you come to a state of disease, especially with non-communicable diseases like diabetes, cancer, asthma, so many different things, that especially diabetes and cancer, there is a lot of association with diet. So much so that when you look at the management of some of the non-communicable disease conditions, diet plays a very important part in this whole thing. When we were residents, you won't see that now. Your young dietitians won't see that now. But when we were residents in NIMHANS, we used to be very excited in seeing a noting called insulin diet. I'm sure Beena remembers that, So we were very excited and wondered what it was. So when patients used to be given this treatment called insulin coma therapy, after that, to wake them up, they had to be given a special diet. We thought it meant high protein diet. So after that, we used to write in the case notes, not realizing that, it didn't, perhaps it didn't have egg, it was more carb oriented, but we wanted patients to get extra egg, etc. So we would write special diet. So from that time onwards, I think things have changed a lot. I remember when we went to mental hospitals, this was about in the 1990s, the diet per patient used to be as low as 12 rupees per day. For full day, it used to be like that. So one of the recommendations that the committees which went there said, you should not do it on the cost of the diet. You should do it as per caloric requirements, adequate carbs, proteins, vitamins or other essential elements. So make sure that you have a diet, like that. And since then, they actually, even for chronic mentally ill in mental hospitals, the diet transformed hugely. Even in hospitals where the diet, the amount of money using for the diet was very low, the superintendent or somebody would try and make some variations, or you'd have people getting in food and so on. But the bottom line why I'm saying this is diet is very, very important, not just in hospital, but also when patients go home. A lot of our patients in the OPD ask us, what should the diet be? Because they wonder with some medicines whether they should change something or not have something. And in India, we know that there is both the problem of overnutrition as well as undernutrition. So we have the double epidemic of overweight as well as malnutrition. So I think the role as dietitians becomes very, very important to make sure that people are eating properly, not just adequately, but appropriately, that they're eating smart. Nowadays, of course, with a lot of changes in dietary, in all the guidelines about diets, unfortunately, people are also going the other way. There are all kinds of fancy diets that people try, lose suddenly 15 or 20 kgs of weight in a few months, become depressed. So we know that there is an association between the diet that people take and their psychological state. So it's very important. It particularly excites me to see a lot of young people here working as dietitians in the hospital. I was just telling all of you, this is a great place to work in. These are wonderful patients to interact with. They're very open to suggestions. And I know now that you have to make a recording of the diet that you advise in the case files, which is great. I also want you to be available to outpatients who might want dietary advice. Very good. Particularly people with metabolic syndromes, that might be because of other problems or because of the medicines they are taking. All of them will value the advice that you give them very much. So I think it's a very important role that is happening, that you are doing. And it's wonderful to see that you have initiated this particular activity. I'm sure all the colleagues who are listening online also would be very excited to see that there are so many dietitians who are available to give dietary advice to our patients. And therefore, I really congratulate all of you on this initiative, including the administration, Beena, Matthew, and all of you. for having initiated this. And I hope this is the beginning of a very good plan for all our patients to be aware of the importance of diet, to know what diet to follow, and not just the dietary part of it, but to look at good living styles or lifestyles so that they can modify their risk factors to disease and health and be healthy. Congratulations once again, and thank you very much.
Thank you, ma'am, for enlightening the gathering with your precious words. Now, I request Dr. B.S. Shankara Narayana Rao to propose the vote of thanks and mark an end to the opening ceremony of National Nutrition Week NIMHANS 2021.
So good morning to all of you, and it's a great pleasure to be part of this important program. And on behalf of each one of you, I thank the director for envisaging this program. It's extremely important that the nutrition becomes a part of our healthy life. And a week-long program, what we are going to conduct, and the theme is very apt, feeding smart right from the start. The start is the day one of conception. We call it as a pre-birth, and then post-birth, and then throughout our life. So we need to have a wonderful balanced diet, and the nutrition is a critical component. In fact, most of the nutrition schedules which we are going to use, which will be very helpful for the infants. So you have the metabolic disorders. Inborn metabolic disorders can be corrected if you identify well in advance. And most importantly, in individuals who is affected in different disease conditions, the requirement of a balanced diet and also balance the dietary maintenance that forms a critical component for all the drugs and therapies which is going to facilitate the overall recovery, and the outcome will be different. And if you look at the general body metabolic activity, accordingly, each one of us, the feeding schedules or the dietary requirements, everything will change. So that way, it becomes extremely important. The dietitians, they play a key role in the hospital setup, looking into what is the actual requirement of the diet and what should be the component of a diet which is required, both in the neurological or neurosurgical and psychiatric conditions. And more importantly, lifestyle disorders. So beyond our hospital, if you look at it, most of the disorders are associated with our lifestyles. As our director mentioned, it's not only the diet, but the diet and also our lifestyles both should match for keep your body, mind, and brain be fully functional. So that way, the contribution of each one of you for shaping the better recovery and faster recovery, and also with the different kind of dietary regimes we are going to advocate for the patients, is very, very critical. I'm very sure that each one of your contributions are significant for the outcome of the patient recovery. So on behalf of the hospital administration, MS, DMS, RMO, on behalf of administration, on behalf of director, I take this opportunity to thank the leader, Veena Matthew, and Pushpa, and all the young dietitians. And also, most importantly, you have initiated now providing your inputs to the OP patients as well. So it's a good thing which you are doing. And it's more apt that this week we are celebrating as a nutrition week. It's a national nutrition week. And each one of the topics, I just saw that. So being a physiologist, I know what is the importance of the diet in terms of the brain development, also brain functioning. So those things in the healthcare and the patient management, the topics is very, very apt. So each one of you, what you are going to discuss, your colleagues and also the healthcare providers, including the nurses and the clinicians, they spend some time and they will understand and also facilitate the overall recovery process of the patient, both in the IP as well as in the OP setup. So once again, I take this opportunity to thank our director. And also now it is the Amrit Mahotsav of our independence. Every week we have one or the other programs has been planned as our director has scheduled for the entire year. We are going to have the program. And this week we are celebrating the National Nutrition Week. And I'm sure that this is going to be very, very useful for each one of us. Thank you very much for taking part in this. I also thank all our colleagues who are taking part in online. And please attend every day. The schedule and the link has been sent. And make sure that you attend. And any inputs are required. And please provide the inputs to Srimati Beena Matthew. And also interact with our dietitians, and so that it will be very helpful. So thank you very much for taking part in this. And so I once again thank you, Beena.
Thank you, sir. Thank you.
Vote of thanks. Thank you everyone for joining the event and wish you a good day ahead.
A nutritious day ahead.
So if all of you are online, we have a small brief video related to the nutrition. And so please watch this video and you can give your input to us.
Happy National Nutrition Week. We are celebrating National Nutrition Week from 1st September till 7th September, and the theme is Smart Feeding Right from the Start.
Feed your child correctly and teach them about good nutrition.
Never put solid foods in a bottle. This can cause choking or overfeeding.
Do not give your child cow's milk until she or he turns 1 year old. This will decrease allergy complications.
Once the baby is ready for the solids, add a new food at a time and try it for 2 to 3 days.
Offer food 10 to 15 times. It may take that long for your child to accept it.
Offer less of milk and fruit juices in between meals to prevent fullness.
Be a good role model. Eat the way you want your child to eat.
First 1000 days of life should give good nutrition so that the rest of the life will be safe and good.
Very nice. First topic, if you have types, 7 minutes. Okay. First today's. The meeting.